Hello everyone, my name is Dr. Sikandar and today we will discuss about the clubbing. So let's start. What is the clubbing? So in simple terms, clubbing is the bulbous enlargement of the fingertips along with increase in antero-posterior as well as lateral curvature of the nails. So here we can see this is the normal finger, this is the normal nail and this is the clubbed finger. Clubbed finger is having more antero-posterior diameter and more lateral curvature, and this is like bulbous enlargement of the fingertips. And here we can see another nail which is having coelonychia, and this is like spoon shaped nail. So what is the definition of clubbing? Clubbing is defined as the bulbous enlargement of the terminal phalanges due to proliferation of connective tissue between the fingernails and the bones. So between this fingernail and the underlying bone there is connective tissue, and the proliferation of this connective tissue will lead to bulbous enlargement of this terminal phalanges, and this is known as clubbing. What is the importance of clubbing? The presence of clubbing in a person almost always indicate the presence of a serious underlying infection or neoplasm of one of the major system of the body. So it often indicate underlying suppuration. There is infection, underlying infection is there. It may indicate the presence of underlying malignancy, and sometimes it could be innocent bystander. Then they are telling like what is the another name of the clubbing, because it was Hippocrates who first described this clinical feature. So clubbing is sometimes but only rarely called as Hippocrates fingers. Otherwise it is simply called as clubbing of fingers. What is the pathology of clubbing? The soft tissue swelling is due to interstitial edema. Very, very important. So interstitial edema and dilatation of the arteries and capillaries occurs in the clubbing. Then what is the pathogenesis of clubbing? They are telling anoxemia due to any cause. Means there is anoxemia, like decreased oxygen in the blood. So anoxemia due to any cause leading to vasodilatation and the proliferation of subcutaneous tissue of the nail bed. And there is increase in capillary permeability leading to interstitial edema. We have already talked, like there will be interstitial edema and there will be proliferation of subcutaneous tissue of the nail bed, and there will be vasodilatation and anoxemia will be there. So anoxemia due to any cause will lead to vasodilatation of the fingers, which will lead to proliferation of subcutaneous tissue. They are telling unknown humoral substance will lead to increased capillary permeability, which in turn lead to interstitial edema and sponginess of the tissue. Other mechanisms like platelet activating tissue factor and hepatocyte activated factor will lead to proliferation of subcutaneous tissue. How to examine for clubbing? So bring the fingertip of the patient to the eye level of the examiner and carefully look at the angle between the nail and the nail bed. So we know this is the nail bed and this is the nail. So what is the angle between these nail bed and nail? It is usually less than 160 in normal individuals. Means it is acute in normal individuals. If it is more than 180, it is like it is obtuse angle, then it will lead to clubbing of it is because of the clubbing finger. So like if, and this angle is known as lobby bond angle, lobby bond angle, lobby bond angle. So lobby bond angle, if it is normally less than 160 in normal healthy individuals, if it is more than 180, then it is due to clubbed finger or it is like not normal. Any alternate method to examination? So they are telling bring the fingers of opposite hand close to each other and look for normal diamond shaped gap between the two nails and the proximal nail fold. This gap is reduced or obliterated in clubbing. So if there is like gap is visible, then this is known as like this method of demonstrating clubbing is called as Samroth window test. Normally Samroth window is visible in normal healthy individuals, but if it is not visible or it is obliterated, then this is in clubbed finger. This was first described by Dr. Samroth, a South African physician who demonstrating in his own body. What is the diamond sign? While doing the Samroth window test, where the middle fingers, so this is specific to the middle fingers. So where middle fingers are pushed against each other with the nail touching so that you can see a diamond shape in the middle. When the diamond shape is not visible, then we will call it a clubbed finger. So here we can see in this diagram diamond shape is visible. So Yeah, this is normal healthy individual, and here we can't see or like this is obliterated. This space is obliterated, then it is known as clubbed finger. So what are the grades of clubbing? Softening of nail bed and fluctuation comes in grade 1. Grade 2, obliteration of onychodermal angle. So if there is like in first condition there will be softening of nail bed and there will be fluctuation. In second, obliteration of this angle will be there. Then comes increase anterior-posterior curvature in grade 3. In grade 4 comes increase in pulp tissue which will lead to drumstick or parrot beak appearance. Then grade 5 comes which contain hypertrophic osteoarthropathy. So hypertrophic osteoarthropathy comes in grade 5. So there are total 5 grades. Grade 1 is fluctuation of nail bed and in grade 2 there will be obliteration of angle. In grade 3 there will be increase in anteroposterior diameter. Grade 4 increase in pulp tissue and drumstick or parrot weak appearance will be there. In grade 5 hypertrophic osteoarthropathy will be there. What is the purpose of grading the clubbing? So yeah, what is the purpose of grading of clubbing? Grading clubbing is only for the purpose of communication between examiners. It has no prognostic significance. When one says there is grade 3 clubbing, it is understood that AP curvature of nails is increased. Clubbing may not be present even in presence of advanced malignancy, and severe clubbing may be present in even case of congenital or traumatic clubbing only. So what causes bilateral clubbing? Systemic illness affecting respiratory system, cardiovascular, hepatobiliary, and the gastrointestinal system. Uncommonly, the endocrine, congenital, traumatic, and rarely it could be a primary form of disease. So they are telling what are the cardiac cause of clubbing. So tetralogy of Fallot could be the cause of clubbing. Assignmenger syndrome could be the cause of clubbing. Subacute bacterial endocarditis and left atrial myxoma. These are the cardiac cause of clubbing. What are the respiratory cause of the clubbing? So bronchiectasis, lung abscess, empyema, bronchogenic carcinoma, lung mets, pleural mesothelioma, fibrosing alveolitis, rarely fibrocaseous tuberculosis, pulmonary arteriovenous communication. So these could be the causes of respiratory causes of clubbing. What are the GIT causes of clubbing? So ulcerative colitis, Crohn's disease, malabsorption syndrome, polyposis of intestine. What are the hepatic cause of clubbing? So cirrhosis of liver, biliary cirrhosis, hepatocellular failure, hepatorenal syndrome. These could be the hepatic cause of the clubbing. So what are the other causes of clubbing? So congenital, familial, genetic cause could be there. Occupational, traumatic, endocrine, thyroid, acropathy, very important. Primary or pachydermatoperiostitis could be the causes of other causes of clubbing. So we will discuss about the respiratory cause of clubbing. So bronchiectasis. Bronchiectasis is a chronic collection of pus inside the abnormally dilated bronchi of lung. It is usually present in both lungs, especially in the lower lobes. So here we can see these are the dilated bronchi. It presents the low-grade fever, cough, expectoration of large quantity of foul-smelly yellow sputum. So there will be presence of expectoration of large quantities of foul-smelly yellow sputum. Clubbing is almost always present in case of bronchiectasis. Very, very important line. So they are telling like clubbing is almost always present in bronchiectasis. Very, very important. After they are talking like lung abscess. Lung abscess is suppuration of lung, meaning collection of pus in the lungs parenchyma. It form a thick-walled abscess cavity containing pus below and air above. So here we can see this is the air part and this lower part is fluid. This is pus. It is usually present with acute onset of high-grade fever, chills, toxemia, and feature of consolidation in the lungs. Clubbing can occur as early as 2 weeks in course of lung abscess. So it can occur within 2 weeks. So about the empyema thoracis. Empyema thoracis is collection of pus between the layer of pleura in the pleural space. The condition simulates pleural effusion but for the presence of high fever, chest wall edema and intercostal tenderness. Clubbing can present as early as 3 weeks in the empyema thoracis. Pneumothorax like empyema can also result in clubbing. Then they are talking about the bronchogenic carcinoma. So bronchogenic carcinoma is cancer of lungs, especially it is the squamous cell carcinoma which causes clubbing. So we should remember this thing like squamous cell carcinoma used to cause clubbing. The symptoms are several and include cough, hemoptysis, loss of appetite, and emaciation. Bronchogenic carcinoma is an important cause of clubbing. Very, very important. If clubbing is present and patient is having like respiratory symptoms, then we should suspect about clubbing. Clubbing may precede the symptoms of malignancy by weeks or months. Then they are talking about the Pancoast tumor. Pancoast tumor is tumor of upper lobe of lungs with local infiltrate of the tumor into the various structures immediately surrounding the tumor, resulting in severe pain of upper limbs. Clubbing is present universally in Pancoast tumor and it is a painful and usually unilateral. Very, very important. This condition is usually unilateral, at least in the beginning of the illness. So, what about the cardiac causes? First is bacterial endocarditis. Bacterial endocarditis is due to infection of endocardium of heart by bacteria of low virulence. It is usually complicates valvular or congenital heart disease, producing additional valve regurgitation. It presents with low-grade fever, pallor, jaundice, maturia, splenomegaly, splinter, hemorrhage, and ocular node. Very, very important. Clubbing is considered to be due to toxemia and unknown hormonal factors. What about the thyroid acropathy? The clinical features are those of hyperthyroidism with stare of eyes, tremor of fingers, and frequent loose stools, along with tachycardia and thyroid swelling with bruit on auscultation. Thyroid acropathy is clubbing seen in the advanced case of thyrotoxicosis. Very, very important. In case of advanced case of thyrotoxicosis, it will lead to thyroid acropathy. Clubbing can occur in other endocrine diseases like acromegaly and hyperparathyroidism. What about the pachydermoperiostitis? Pachydermoperiostitis. This is primary form of clubbing. In this instance, clubbing is accompanied by skin changes such as hypertrophied skin and on the dots of the hand. It is very rare cause of clubbing in our population. What causes unilateral clubbing? So they are telling cervical rib, pancreas tumor, aneurysm of subclavian artery, pre-subclavian coarctation of aorta, and AV fistula involving brachial vessels will lead to unilateral clubbing. So it will be because of unilateral cause only. What is differential clubbing? Clubbing limited to upper limbs or lower limbs alone is called as differential clubbing. Clubbing may be limited to the upper limbs in chronic obstruction of vein of upper thorax. A common cause is phlebitis of the upper extremities as seen in IV drug users. What are the differential clubbing in the lower limbs? Clubbing may be present in lower limbs only, totally sparing the upper limbs. It may be associated with cyanosis of lower limbs. It is classically due to PDA with reversal of shunt, Assenmenger PDA. So classically it is due to this patent ductus arteriosus. It is also seen in infected abdominal artery aneurysm. What is hypertrophic osteoarthropathy? Advanced stage of clubbing is called as hypertrophic osteoarthropathy. It demonstrates all the feature of different stage of clubbing. In addition, there will be thickening and tenderness elicited over the end of long bone by of hands as well as feet. It is seen classically in Pancoast tumor, but also present in severe case of suppurative lung disease and lung carcinoma. What are the bone changes in HP, hypertrophic, hypertrophic osteoarthropathy? So they are telling like hypertrophic osteoarthropathy can be diagnosed from X-rays of end of long bones. The periosteum of end of long bones are elevated. Periosteal new bone formation give rise to appearance called as sunrise appearance. Very, very important. So periosteal new bone formation will give rise to sunrise appearance. Also, there are symmetric arthritis arthritis like changes in the shoulder, knee, ankle, wrist, and elbow. They could be there. So, which condition have clubbing and cyanosis? So, tetralogy of Fallot and this Assenmenger syndrome have both of the condition like clubbing and cyanosis together. What is the treatment of clubbing? There is no treatment specific for clubbing. The treatment is for primary condition only. Cure of the primary condition can totally reverse the clubbing. So that's it all about the clubbing. Thank you so much.